Okay, Assalamu alaikum, everyone. Thank you all for joining us tonight. Really excited. We have a really good presentation for you. Just a little bit about the Muslim Professionals Network. For those of you who don't know, we started this initiative mid last year in effort to kind of bring us together as a community in different various fields, tonight being the medical field, obviously. One thing that I want to do is to make sure that you guys all know that this is a resource for all of you guys to come and participate in. Dr. Zakah, he came to me with this idea that he's had, and so it's kind of the whole purpose of why we started this whole group, to present ideas like this and to be able to benefit our community. I'm really excited. We've been talking about this for months. And so in addition to that, while we were working on this presentation tonight, there was some other nice surprise, which he'll share with you tonight, that involves the center as well. So all the donations, all the things that we've been putting into this building to be built for us to benefit from it, as you can see, it's already starting to kind of come back to us in this community. So just a little bit about the itinerary. So Brother Zach will go ahead and he'll do his presentation. We'll do a quick Q&A session. We'll break for Maghrib. We'll pray Maghrib, and then we'll come back up here. Before we do the networking portion, just you guys just introducing yourselves to each other, letting each other know what you guys do. We have Freedom Bakeries over there. They want to speak in regards to some initiatives that they have going on in Gaza. And from there, like I said, I just enjoy the night, speak with one another, get to know each other. And, at that point, I mean, there's no hard set time of when that ends. If you have to go, you have to go. But, spend as much time as you can and really just trying to get to know each other. So without further ado, Dr. Zakir.
Thank you, Brother Shaban. Assalamu alaikum wa rahmatullahi wa barakatuh, everybody. Bismillah, walhamdulillah, wa salatu wa salam ala rasulillah. My dear brothers and sisters in Islam and in medicine. Let me go back. Yeah, leave it there. I was doing some reflecting, and I saw the big hospitals that we have and that we all work in, mashallah. I saw medications to treat diseases of every kind and surgeries with precision that will really astonish you. And I got curious. I wanted to know, what is the origin of this? What was the backstory of all of this greatness? What I found was very beautiful. It was inspirational, but it was also devastating. It was in Iraq where, in my opinion, the most important medical advancement in history was made. The medical advancement that all medical advancements after it probably wouldn't exist without it. It was hospitals. Muslims invented hospitals in Baghdad, in Iraq. They never taught us about that in school. Very, very strange. They also created the first ever clinical trials. You know, the process that all of our guidelines are derived from, and where the pharmaceutical companies are making billions of dollars off of, that is a Muslim institution right there. Also, Muslims invented pharmacies in Baghdad as well. Now, unfortunately, much of this infrastructure is gone. The Mongol Empire did end up destroying it. Wow, the Mongol Empire. Every time we hear about the Mongol Empire, we hear how large they were, how vast they spanned, all the way from Eastern Asia to Western Europe. Wow, they went all the way across. And then when we're talking about history, we just skip to the next, okay, then the Middle Ages. Well, wait a second, what happened to the Mongol Empire? Why are you just talking about how big and bad they were? What about, what about their downfall? It was in Egypt where the Mongol Empire suffered their first and most decisive defeat. Their progress was completely halted by Muslims in Egypt, and they were never able to fully recover again after that. But something else happened as well. You see, when they were destroying these hospitals in Iraq, and these pharmacies, and the libraries, they became very impressed. And they hired exclusively Muslim doctors for the rest of the entire Mongol Empire to take care of them. You see, the Mongol Empire had three main heads. There was the Persian Khanate, where Persia is or Iran is today. The main portion, which is where China is in Mongolia today, and a third portion where India and Pakistan are today. These doctors, they did something very special. They did dawah within the Mongol Empire. You see, when you do dawah as a medical professional, it's so profoundly impactful. We are on the front lines doing very meaningful work, really touching people's lives. So when they learn about our way of life, it's a little bit different than just somebody else or in a different type of setting. Within a few years after the Mongols adopted Muslims as doctors in their empire, and after that defeat in Egypt, 100% of that Persian portion of the Mongol Empire became Muslim. And I don't mean about the Persians that already lived there. I mean the Mongolian emperors and leadership and all the Mongolians who lived in that region became Muslim, 100% of them. 100% of all the Mongolians in the second portion, where India and Pakistan are today, also became Muslim, 100%. You know the last name Khan? A lot of our Desi brothers and sisters have the last name Khan. Genghis Khan. That's where it comes from. It comes from that time period. And right after that, we had the amazing Muslim Persian Empire and the amazing Muslim Mughal Empire. Doing dawah as a medical professional can literally change the world. They literally changed the world. That's not hyperbole. They changed the entire world. The Mongol Empire disappeared. So this is one of the main points I want to drive today, is that we should be doing, some light forms of dawah as medical professionals as well, as the best that we can. Moving on. We have Al-Andalus, where we have Dr. Al-Zahrawi, one of the most profound physicians that ever lived. He invented over 200 types of surgical instruments, such as the scalpel, many of which are still used today. He also invented a very precursor to the C-section. And they also had the very first use of anesthesia and first publicly documented health initiatives. So, wash your hands, stay, don't do this, stay healthy. A lot of the public health initiatives that we see today, also invented by Muslims. Now, Al-Andalus was very interesting as well, because this was also a Muslim empire, of course, and unfortunately it fell to the Reconquista in 1492. The Christians fought a very expensive, long war to take over Spain. What else happened in 1492? Does anybody know what else happened in 1492? Yeah, who sailed the ocean blue? Columbus, right? Christopher Columbus came to the Western Hemisphere in 1492 to the Americas, right? That's very expensive, though. How did the Spanish afford that? They just fought a huge war with the Muslims, and then you have to build these giant ships and send Christopher Columbus and his crew over. That's very, very expensive. Well, here's something else they didn't teach us about in school. That money that was used was Muslim money, right? Once they took over Spain, all the riches that the Muslims had now became the Christians. So the credit for the person who discovered this country was funded using Muslim money, right? But they never taught us about that. That's very strange. Obviously, it wasn't the Muslims' intentions to fund that, but they did use the gold and silver that the Muslims made to fund that journey. SubhanAllah. And then we have the Ottoman Empire, where the world's first women's-only hospital was invented, and the first ever military medical corps. Now, every single military in the world has a military medical corps, right? They also invented precursors to vaccines and vaccine documentation. All the vaccine cards that we saw a few years ago, those were invented by Muslims as well. And Uzbekistani-born Ibn Sina, he is known, he wrote the most prolific medical book in history. It's called the Canon of Medicine. That book was the gold standard for over 600 years, all across the world, translated in all different types of languages. Imagine that. I mean, today there's new guidelines every year. There's new textbooks every semester. His work was relevant for over 600 years. SubhanAllah. Things that, we're really not taught much about. Muslims in Egypt also invented and created the world's first psychiatric hospital. They were one of the first people to take mental health seriously. I don't know what happened with Egyptians since then, but they did, right? Yeah, still happening. We're restarting. They also made significant advancements in pharmacology. I guess that's why there's so many like Egyptian like every pharmacist is Egyptian. I'm one of them, but every pharmacist is Egyptian. Maybe it goes back to this. I'm not quite sure why. Also, the first hospital with dedicated departments. Okay, so the PEDS department, infectious diseases. This was a first in Egypt. And then we have Palestine. In Palestine, in my estimation, the single most important medical device, or not medical device, medical tool or medical supply ever was invented. You see, in Palestine, the gauze pad was invented. And the gauze pad is very interesting because it's named after the place that it was invented. The gauze pad was named after Gaza. And these are just so many, this is why I said I saw a lot of beauty and a lot of inspiration, but also some tragedy when I looked into this, because we were never taught many of these things. And I found myself wondering, when can we reclaim this? Because this is our legacy, of course. Right? And I thought, how did this happen? Right? Why did Muslims have such big medical advancements? There's two reasons. First and foremost, it's because Allah subhanahu wa ta'ala instilled these values within us. وَإِذَا قُضِيَتِ الصَّلَاةُ فَانْتَشِرُوا فِي الْأَرْضِ وَابْتَغُوا مِنْ فَضْلِ اللَّهِ وَاذْكُرُوا اللَّهَ كَثِيرًا لَعَلَّكُمْ تُفْلِحُونَ. And after the salah, go and seek Allah's bounty and remember Him frequently so that you may be successful. And that's exactly what these people did. They sought out the bounty of Allah. They sought out the knowledge of Allah. They remembered Him frequently. The Prophet Muhammad sallallahu alaihi wasallam, he says that cleanliness is half the deen. That obtaining knowledge is compulsory on all men and all women of the deen. And by the way, all these hospitals and institutions I mentioned, there was female doctors in them as well. Female doctors, nurses, pharmacists, all over. Okay? And there's a second reason. It's because these achievements were not done in isolation. They were not done with individualism in mind or in fragmentation. They were done in the context of Muslim faith-based institutions. Institutions that today we don't have in this country. And I know many of you are thinking, well, why do we need Muslim faith-based institutions? We're all, mashallah, we're working at these big hospitals, we're working in these big pharmacy chains. Why do we need a Muslim faith-based clinic or a Muslim faith-based institution, do I mean? Well, let's go through the progress of a people coming to a certain area, right? First, they come and they live, right? Like we came to America, we started living here, but there was no masajid, right? We're a religious community, so there was no masajid here. So first step is coming here. Second step, establishing our religious institutions, okay? So before that, we weren't really able to pray in the masjid because there was no masjid, right? We were praying in other places. The next step after that is to have your own institutions within your field. So the very next step would be for us to have a Muslim faith-based institution. And for those of us that are saying, again, why do we need that? We are already working in these amazing places. What's the point of that? It's because just one step behind that, we don't even have masjids anymore. That's as if we don't have masjids and we're just we're working in churches or we're working in temples. Sometimes they let us pray there. Sometimes they post a picture of us, like they shout out Ramadan or something. They post a picture of a hijabi like many of these big health systems do. That's where we are right now as a medical community. We're working in these other places, but we don't have a place to call our own. We're not self-sufficient. So that's why today I'm here to announce an organization that I've created, and I'm here to share it with you. Oh, by the way, this is the gauze pad. If you zoom in, it looks like a kafaya. Brothers and sisters, I'm here to introduce to you Crescent Health. Crescent Health is America's first and only Muslim faith-based health system health organization. And our first project that we are working on actively right now is America's first and only Muslim faith-based ambulance service. We've seen other faith-based ambulance services. Now, inshallah, we will have our own. We have cultural needs, we have religious needs, we have linguistic needs, and they're not being met. Some of you have already filled out a survey I've been doing. I've been collecting some data, some research. And yes, a lot of our community are not comfortable with the current situation with emergency care. Our sisters are not comfortable. There's a huge language barrier in many places. We have to be self-sufficient. This ambulance service is a very real work in progress. We have already gone to several meetings, met with politicians. It is a real thing. It's not just a random idea. It's a real thing that's actually happening. And I'm here to invite you all to help and to be a part of it. We need a medical director. We need social media experts. We need lawyers. We need web developers, artists. There is another project that we are working on as well. This is some AI ChatGPT mock-ups of what the ambulance could look like. Inshallah, we'll have an artist so we could not use AI. But yes, imagine an ambulance racing around the city, draped in Islamic art and Quran, saving lives for the sake of Allah subhanahu wa ta'ala. This would be so amazing. And our second phase, or our second project that we're working on simultaneously, is something I like to call CHAMP. I'm very happy to announce that we have made progress, and we are officially announcing a Muslim faith-based clinic right here in Staten Island to be open soon, inshallah. We've spoken to leadership about it, we've made an agreement about it, and inshallah, it will be opening soon. But we need your help. This is not a fundraiser, by the way. So no, I know we're still donate to the masjid, but not for Crescent Health, nothing. Yes, no, for the masjid, yes, but not for Crescent Health. So yes, there's going to be a clinic right here in Staten Island in this masjid, alhamdulillah, inshallah. Thank you. Allahu Akbar. We'll be doing some, we'll go on a field trip. Whoever wants to come, I'll show you guys. It's upstairs. There's nothing there yet. It's just a space, but we can see the space, inshallah, for whoever is interested. During the networking portion, I can take a few, and we can go upstairs, inshallah. Yeah, it's awesome. So I'm very excited to announce this. But again, we need prescribers. Okay? We need prescribers who are willing to come. We're targeting low and underinsured or uninsured patients at this time. Also looking for pharmacies to partner up with as well. And this is going to be a community effort. Okay, it's time for us to give back to our own community, and then soon, inshallah, we'll be giving back to the rest of the community. Because that's a part of da'wah as well, right? If you want to invite people to Islam, well, what have we done for them, right? So this will eventually lead to that. But for now, we're going to be starting right here in the masjid, inshallah. And it will probably be just like a weekend clinic for a few hours on the weekends, and inshallah, we'll grow from there. Okay? First, it will be on a volunteer basis, and then soon after, when we're able to gain a little bit more traction, we'll be able to bill insurances, et cetera, et cetera. But for now, it's going to be a charity clinic, and we will expand from there, inshallah. Okay. So these are some 2 QR codes. I need everybody, inshallah, at some point today to scan them. One of them is a survey, so that we can keep gathering data. The more people I have, the closer that p-value is, as you guys know, to being statistically significant. I'm serious. We're doing a real study. And if you're interested in joining Crescent Health, the QR code, I think it's flipped. I'm not sure what it is on there, but the one that says Join Crescent Health, that's an outreach form. So if you want to join, if you want to do this, X, Y, Z, volunteer, if you are a medical director or know someone, or if you know a politician, or if you know a precinct, because we have to also have a lot of connections. So I invite you guys to scan that as well. You know, Allah subhanahu wa ta'ala, He says that the one who saves a life is as if he saved all of mankind. So how many lives can we save, right? How many mankind's and earths can we save? I invite you guys to save these lives with me. And inshallah, that is the end of what I have to say for today, and I'll be opening it up to questions for anyone who's interested in asking a question. Jazakallah khair.
Are you planning to open the clinic as to like everybody, like doctors, nurses, things like that? Like, what is the vision on how you're going to do this? Is this going to be physicals? Is it just going to be blood pressure taking? What is your vision on that?
So the brother is asking a question about what's the scope of the clinic going to be, who's going to be the providers, the patients that we're targeting. So the clinic again is going to start out very humble. It will be focused mainly on family medicine and just very common disease states, diabetes, cholesterol, blood pressure, et cetera, et cetera, et cetera. Maybe some urgent care things. But anything that we're not able to take care of, obviously, we'll be referring out. But in the beginning, it's just going to be more checkups and disease state management, inshallah. And yeah, anyone who's able to prescribe, MD, DO, obviously PA, NP, is invited to volunteer, inshallah. Yes.
Yeah, and it would also depend on grantors. Like if we have a grant to cover a certain mental health, for example, it's like that. So that may be prioritized if we receive such a grant. So, in addition, of course, to what you mentioned, that could be also considered.
Yeah, so he was just basically saying that grants also will play a huge role in this, federal grants, obviously community donations as well, of what is most important to focus on, what our community needs, of course, that's also something very important to discuss. What does our community need in the moment right now? But just to kick things off, the simplest way to just get things going is as I discussed. And of course, we have a lot of mental health professionals as well. That'd be amazing. Yes. So the ambulance service, they're very territorial. Okay, so that's what me and my partner who's here, we're dealing with right now. They're very territorial. We're probably going to start off you need to make a very good case for an ambulance service, and you also have to go to a public hearing, by the way. And we will need as many people as possible to show up to that public hearing when that happens, just to show the support. The most logical place right now would probably be Bay Ridge, Bensonhurst, because that is the largest Muslim community in America right now by numbers. Right? Michigan has more people by percentage, but Bay Ridge has the most Muslims right in America. So, just for logical reasons, for them to not say anything or to deny it, because you can't just open an ambulance. By the way, there's lots of regulations, and you have to get approved, which is what we're working on now. It's probably going to be Bay Ridge, Bensonhurst, Bath Beach area, like where Mass Youth Center is, basically, because that's where the highest concentration of Muslims are. So that the non-Muslims will see, okay, yes, it makes sense. There's the most Muslims there, and then inshallah there is room for expansion to Staten Island as well.
And this is technically a private ambulance, like, or is it going to be like something you'll have dispatched from the city that would be calling over? Hey, we got a Muslim here. We got.
So he's asking, like, is this a private ambulance or is there going to be dispatch from 911? We will be integrating the 911 system. It's going to be a volunteer ambulance service in the beginning as well, like I said. And again, Crescent Health is a nonprofit. It's not my company. It's all of ours, right? Just because I'm the founder doesn't mean it's mine. Everybody is a part of it. It's here for everybody. It's everybody's organization. So yeah, it's gonna be a nonprofit, and it's not privately owned or anything like that. And we will have a direct hotline, but also integrate into the 911 system. Yeah.
So currently, especially here in New York, but I would assume also nationwide, faith-based ambulance services are they carry a very negative perception amongst people, because of the assumption that they're only serving their own faith, particularly the Jewish organization. So how do we plan to navigate that? Because it could actually harm. It could cause harm.
So Sheikh asked a very good question. He said, right now, faith-based ambulance services. Sorry, I know I'm just repeating it. They carry sometimes a bad connotation because people think that they just serve their own population. They don't serve the others. Well, we're going to make sure that we don't just serve for the Muslims, because this is actually part of my broader vision of doing dawah through medicine. This is going to be amazing when people can see how Muslims do medicine, right? How we take care of patients. Imagine, the ambulance services, doing a dua for someone, just saying, oh, can we pray for you? Something like that, And also just taking our excellence to the community as well. It's not going to be just for Muslims, and we're going to make that abundantly clear. It's a Muslim faith-based ambulance service, which means we abide by Islamic ethics, Islamic, gender roles and identity, inshallah, things like that. But it's not going to be just for Muslims. We'll make that abundantly clear. And this is going to be, a very amazing part of dawah as well. An actual Muslim institution where it could be the majority of our patients are not Muslim. That's actually my goal.
You said something about gender, right? So you're going to have both female and male, like separate ambulances? Is that what your plan is?
Yeah, so one...
Or it depends on how they feel about it?
Right. So he's asking how, since I mentioned gender. Yeah. So one of our visions is actually to have like a all female crew on one of the ambulances, which would be really nice to have. And then we could have more of we can have a male one, and then we could have just like a mixed one, right? So to having a sisters only one would be great, because a lot, again, in that research that we've been doing, a lot of sisters felt very uncomfortable. They're being grabbed, they're being carried, pulled, their hijab is flying off. So this would be great. And the best part is we have, our community is saturated with medical professionals. It's saturated. We have a lot of this talent. So it's time for us to show them with an Islamic lens, with the Islamic banner, you know what I mean? Right now we're all doing this, we're working at these other institutions, but if we're doing it, under the name of Crescent Health, under the name of Islam, it's really going to do amazing dawah, inshallah. So that's my vision for that.
I like the clinic idea, though. It's pretty cool. It seems like there's a lot of use that you can get with that here. We have a lot of prescribers, obviously, that are in our community at the main hospital in Staten Island that we have. We have residents, we have medical students, things like that. If they wanted to volunteer, that might be something unincorporated.
Yeah, inshallah, and that's also why we had this event, to see if anyone even here wants to be a part of it, or spread the word. Spread the word if you don't have the credentials at this time, or inshallah you will one day. But this is one of the goals of the event, and of course the networking portion as well is very important. Yes.
I know you spoke about the types of prescribers that you guys are looking for, but is there a vision for other disciplines of healthcare, the therapeutic, we have the physical, the physiotherapist, the speech therapist, occupational and whatnot? Is there a vision for you guys to reach out to them, or is this simply just prescribing physicians?
Yeah, so that's a really good question, and also that's why we have events like these. Right now, you'll see the space is very limited upstairs, but that would be great too. But I'm not quite sure how that would work, because the physical therapy sessions sometimes are a bit longer. If these clinics are shorter, but that's definitely something we're interested in as well. As space allows, and this is only the beginning. Like I said, inshallah, this will be an institution one day. So we will, of course, we will be multidisciplinary. Yeah, so she's asking, is EMT certification part of the vision? Yeah, it's required. So you have to. Well, you have to get EMT certified through like a school. Yeah, yeah. Yeah. Yeah, yeah, 100%. Yeah, yeah. In order to be an EMTS, but if you want to be a dispatcher or doing anything else, obviously you don't have to be EMT certified. Not yet. No, another reason for this event. But yeah, soon, inshallah. Or yeah. Yeah, you can call in a prescription or use the physician could also use their own personal prescription pad from their practice because it's a charity clinic. It's not associated with a private practice or with a health system. You know, you're able to do that. Yes.
Is there a timeline for this? What's the timeline looking like?
Right now we have the space. We're just working out a few regulatory things. He's asking what's the timeline for this regulatory things, and we're recruiting, prescribers right now as we speak. So technically we have the space. We just need the furniture and just making sure everything is compliant legally. As soon as that happens, I mean, we're ready to go, right? But we're still going to be discussing that. But I would hope through the summer/fall, but I don't know. I don't know. But it all depends on the community, really. Prescribers, grants, or we have to buy the furniture as well for the clinic. But very good question. And yeah, the ambulance, the timeline for the ambulance. We're working on submitting the application. Now the application is very long. It's a few hundred pages long, and it involves getting letters from politicians, precincts, restaurants, masajid, everything to put in there to show that the community supports it. So we were doing the ambulance more quietly because we didn't want really any interference, and I don't mean within the community. I mean like outsiders, going against us. Like people are not going to be happy about this, and they're not. Just by the way, they're not. But after several meetings, they basically told me, this can't be like a little secret project. You have to get the community support for it. The community has to be very, very like rumbling for it. You can't just sneak it in, because I wanted to just sneak it in there and then tell everyone, oh, we have certificate, now let's do this. They said no, you can't do that. You have to do the public hearing. There has to be public support and public need as well. Okay, so we're working on that right now. He's talking about the psychiatry, going back to the history lesson. I meant like the psychiatric hospital. I don't know about a clinic, but I'm not sure about the name, but the first psychiatric hospital, the entire hospital, not just a clinic. I'll get back to you. She's asking if there's accessibility to the clinic. Yes, it's fully accessible. There's an elevator and stairs as well.
Is there going to be any sort of budget in terms of like for the ambulance or for the clinic? Are you guys going to be needing like support in terms of like buying certain items, or is that like already taken care of? Like, what's like?
He's asking, will we need financial support? Ambulances are expensive, clinics are expensive. Absolutely, we will. It's not fully taken care of, but we don't want to start, taking donations yet. We just came back from Ramadan. We need a break. We need a refill, and then, yeah. So another thing is, especially with the clinic, inshallah we could, but the ambulance, the thing is that we don't want to take donations and then it keeps getting roadblocked and they keep denying it, and then like what are we supposed to do with all the money? So how the ambulance works is they'll accept like letters that say, if the certificate, it's called the certificate of need. If the certificate of need is granted, then I will donate X amount. So they just want to see some people saying that they will donate, like letters stating that. But yeah, of course, we will of course need financial support. But that's not what this event is for today. Today, we're just looking for community members to join in and for networking, inshallah.
You said that in the future,
So you're saying the future. So within the masjid, it probably will always be free because it's inside the masjid. But as the Crescent Health system, inshallah, grows, I do see it, inshallah, being an entire health system one day, with ambulances, clinics, and even bigger than that. Right? We have so many. And every single hospital, right, that we're seeing today is a faith-based hospital, almost, right, except for Northwell. There's some sort of religion attached to it. So, that's really my ultimate goal, is to get there one day. But right now, this is where we're starting.
Baby steps.
Yes.
In regards to the pharmacy offering its voluntary services, what's expected out of it?
That's a good question. I don't know if I want to have I don't know if I expect the pharmacy to also give the medication for free. I don't think I'm going to do that. As a pharmacist, I know it's very expensive, but inshallah, also a faith-based pharmacy, like or a pharmacy that exudes Islamic values, right? So that's something to be worked on, but we will need pharmacy partners 100% to send patients to, so that we can have the full circle, Islamic values in healthcare all the way around.
We have time for a few more questions. And you guys, if you have just thoughts and feedback, you don't need questions.
Yeah. Yes.
Mention this. What are the hours hours of operation when you guys function?
He's asking about the hours of the operations of the clinic. It's still undetermined. It depends on the prescribers, right? When are they available? Are they available? Are they willing to come? But most of these types of masjid-based clinics are usually like from 9 a.m. to 12, 9 to 1, something like that. But eventually, again, it will grow. It will expand, and eventually, I want it to be a full-time clinic, Monday through Saturday. 10 to 6, a full, for Muslims and non-Muslims. But that would not be upstairs, of course. It would be somewhere else. But that's the goal. So first, start off like this, just to get it started. We were actually going to do the full-time clinic first, and we were trying to find a space for non-Muslims to walk in, but it was just too much. So we decided to just do the weekends only one for now, just to get things started. Yes.
Do you have an estimate of what this would cost in terms of everything? I assume physicians are all volunteered. They wouldn't be offered stipends or anything?
For now, and again, inshallah, soon I definitely want to pay everybody, and me too, but no, but eventually everyone. But right now, it's all volunteer, including me, of course, and it's going to be like that for a long time. The other part is,
They asked double question.
yeah.
That's how roughly, like everything included, insurances, obviously, like malpractice insurance, not insurance for the.
The clinic itself, see, the malpractice insurance is another caveat. I have to see if prescribers are able to use their own, or we have to do a coverage. I'm still working on that. With regards to the ambulance, the costs, yeah, it could cost about $500,000 for a couple of vehicles, dispatch, uniforms, materials, et cetera, et cetera, et cetera. The clinic shouldn't be very expensive at all because we have the space. We just need the furniture.
We have time for one more question.
Of course, intake, people for administrative things. Like I said, we need everything. Everything, even artists, like we have lawyer, everything.
Who's that?
There's a clinic called Cherry Hill Clinic in Jersey. I'm trying to have them help me walk through it. So yeah, they're nearby. It's also a Muslim like clinic. And then there's one in Epic Masjid in Texas, but they're kind of Hollywood. Like it's hard to get in touch with them because that's Sheikh. I forgot his name, but he's a very famous Sheikh. What's his name? Yasser Qadhi, Sheikh Yasser Qadhi, out in East Plano Islamic Center. Chicago as well. Yes. So that's something I'm definitely working on as well, and I've spoken to them, but again, this main event is just for to get the community's feedback, support, and also to see if anybody wants to join in. Last question.
So, Assalamu alaikum. My name is Sharif Ahmed. I'm the executive director here at Staten Island. Once again, warm welcome to all of you. Jazakumullah khairan for the panel. I wanted to acknowledge the lawyer in the room. So I think one resource right here, Brother Ali is a board member as well of MES New York, in addition to the fact that he's, mashallah, one of the founding members here. Also, I want to acknowledge, of course, Sheikh Abdurrahman Badawi, a resident scholar. Sheikh Abdurrahman call to action. Many of his lectures talked about exactly what's being presented here, that we need to really rise to the challenge. We really need to find our own projects, establish our own projects. We really need Islamic scholarship, Islamic entrepreneurship, and many of these initiatives. So that definitely directly comes from, mashallah, Sheikh Abdurrahman. Also, I want to acknowledge Dr. Sam and Dr. Ali sitting right there. They are part of Northwell healthcare system, and mashallah, we had a Zoom call yesterday. Was it yesterday? And we spoke to the community affairs person in the whole system. And they're very much interested in this population here in Staten Island, mashallah. They see a very growing community and they want to partner, providing grants and funding. One of their locations is literally a few blocks away, right? Less than 2-3 minute drive where you guys work. So I think that's important, as well as this community is growing. They took note of that and they really want to provide some services, at least here on premises. They have, brought the health truck before, the blood donation bank, and so on and so forth, and mobile. Last point I want to make, I just wanted to put this in context. We have about, Dr. Ahsan Bekbi has a very interesting study, mosques in America, I think it's called, 2010 and 2020. He says there's about 4,000 masjid across, the entire country, give or take. He estimates about, if I'm not mistaken, $12 billion in real estate assets of these masajid. As you know, CARE has mentioned this before in many of their studies, and Pew Research Institute and so on. There's about maybe 12% of Muslims who are practicing, engage. They frequent these spaces here. The 88% are far less engaged. Many of them, they just show up Friday, and frankly, the vast majority, they just come on Eid, the two days of Eid. So if you have a population of 2,000, imagine you'll have maybe 200 coming to Friday prayers 52 times a year, and maybe 20 who would come to the 5 daily prayers, give or take. So you do the math. Why am I saying this? Because we have a vision, hopefully a narrative that we've been pursuing for a while. When we started building this place, typically these spaces are built by Muslims, for Muslims, and God help everybody else, all the non-Muslims. And the idea is that what if we change this? We are built by Muslims for everyone, and it's our obligation as Muslims to help everyone else. So can we have, healthcare clinics and things like that? We have a food pantry every single Friday here. We have 22 or 23 now recurring programs. One of the programs you're part of, Dhikran, and many of the folks in the room, and Ahmed sitting right there. And so the idea, these programs should serve, our food pantry serves Muslims and non-Muslims. We get a lot of neighbors here, and they come and they pick up way before Friday starts at 10 in the morning and so on. So that's my point. We really need to engage everybody. We need to not to reinvent the wheel. They definitely provide a lot of funding opportunities and institutional funding to faith-based organizations, the synagogues and the churches and so on. So doctors here are making an introduction to, to say, hey, the Muslim community is over here. We are about maybe 6 to 8% in terms of the 500,000 population here in Staten Island, so a good, 40,000, give or take, Muslims, could be more. So I really hope that we kind of like moving towards, directionally speaking, we kind of like going there. And, that's by having this type of initiative, we would, showcase how these things are going to happen. So, Jazakumullah khairan. Just want to give a quick context. We'll still have like 10 minutes before Iqamah, and I'll pass it back to you. And yeah, I really want to thank Brother Shaban. He's been leading this whole effort, mashallah.